Good morning, Excellencies, ladies and gentlemen, and a very warm welcome to this panel discussion on protecting essential health services for women and adolescents and building resilient health systems. I'm Melinda Crane, and I am Chief Political Correspondent at Deutsche Welle TV. And on behalf of our hosts and organizers, the German Federal Ministry for Economic Cooperation and Development, and the Global Financing Facility for Women, Children, and Adolescents, it is my great honor to accompany you today as moderator. We are here to shed light on an emergency that has taken the lives of countless women and children in vulnerable countries across the world, and which threatens the future health and well-being of countless more. And no, I'm not talking about COVID-19 itself, but rather about the massive disruption to essential health services caused by the pandemic. Lack of oxygen and blood supplies, interruption in outpatient services for serious yet treatable diseases like HIV, malaria, tuberculosis. Life-saving interventions like these fell by more than 25% in lower income countries over the course of the pandemic. The result? For every death due to COVID-19 in these countries, more than twice as many women and children may have lost their lives. The crisis I'm describing is ongoing, and together with other social and economic impacts of the pandemic, school closures, job losses, gender-based violence, it threatens decades of progress in improving the health and well-being of women and adolescents, and thereby also, of course, undermines economic productivity and social stability, which is why this event aims not only to raise public awareness, but also to galvanize support for helping countries get back on track in restoring essential health services and building resilient health systems for the future. We have an eminent panel with us to share information and insights on the challenge. Before I introduce them, just let me say that we also welcome your input, dear ladies and gentlemen. As you can see, we are in hybrid format, so you can send us your questions using our virtual tool. That's the Q&A tab on this Zoom live stream for those in our online audience. And if you are with us here in person in the room, and how refreshing it is to actually be meeting in person again, then you can ask your questions the old school way. We do have 2 microphones in the room that you can use for that purpose. And I will be bringing those questions in from all of you, ladies and gentlemen, toward the end of the discussion after 2 rounds of discussion amongst those of us here on the panel. And now I will introduce our speakers, and in order to maximize our time for discussion, I'm going to keep the introductions quite brief and just ask you to consult the website for more information on the very impressive vidas of our panel participants today. It is an honor to welcome, seated next to me, Her Excellency Awa Maria Kolsek. She's Minister of State to the President of Senegal and formerly Minister of Health and Prevention. She's a professor of infectious diseases and has also served as executive director of the Rollback Malaria Partnership. Wonderful to have you with us. And I'm also very, very pleased to welcome Dr. Maria Flaxbart. She is Parliamentary State Secretary at the Federal Ministry for Economic Cooperation and Development and was formerly Parliamentary State Secretary to the German Minister of Food and Agriculture. Great to have you with us as well, Ms. Flaxbart. And seated next to her, it's a pleasure to welcome Rosemary Maburu. She's Executive Director of the African Regional Advocacy Organization, WACI Health, working to boost political will for improved health outcomes. She also oversees the civil society platform on health in Africa and the Africa hub of the Global Fund Advocates Network. And joining us virtually is Marie Pangestu. She is Managing Director of Development Policy and Partnerships at the World Bank and formerly served as Minister of Trade and Minister of Tourism for Indonesia. It's also a great pleasure to welcome Dr. Julia Spencer. She is Associate Vice President. There we see Marie Pangestu. Welcome to you, Madam. Wonderful that you can join us at this very early hour, your time. And it's my pleasure to introduce Dr. Julia Spencer. She's Associate Vice President for Global Vaccines, Public Policy, Partnerships, and Government Affairs at the pharmaceutical giant MSD Sharp & Doma. Prior to joining MSD, Julia served in senior positions at the U.S. Department of Health and Human Services that included the post of Science Policy Director. Thank you so much for being with us, Julia Spencer. And it's my pleasure to welcome Peter Sands, also joining us virtually. He's Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. After a career in banking that included heading Standard Charter PLC, he was a research fellow at the Harvard Global Health Institute and subsequently chaired the International Working Group on Financing Pandemic Preparedness at the World Bank. Thank you also, Peter Sands, again, for joining us at a very, very early hour. And I'd like to begin our discussion by talking a little bit about the nature of the crisis that I so briefly described in my introduction. And I'd like to ask all of you, dear panelists, dear speakers, to please share concrete experiences that can help us better understand what this disruption to health services actually looks like and what burdens it does impose on the vulnerable. And before I begin, I'll also just remind you that we are very eager to be interactive and spontaneous, and therefore I am so grateful if you can keep your answers within the allotted time of under 4 minutes, please. Thank you so much. And I'll start with Minister of State Kalsek, if I may. What are you seeing in Senegal and in other African countries? How has the pandemic, in fact, affected the provision of essential services, and who's feeling the impact?
Thank you very much, and it's a pleasure for me to be here. I would like to say that this is a global problem. As you said, I will focus in Africa, but the figures you share with us at the beginning are so important. And I would like to repeat them. 1 person dying from COVID, you have 2 women or children dying because of the disruption of the health system. And in Senegal, the situation is the same. Maybe we have less cases than some countries in the north and in Asia, Latin America, but it is still a big problem in Africa and in Senegal. For example, to be concrete, you have 100,000 fewer delivery when you look at pregnant women, for example, in Senegal. This is calculation we have done to show that it is a big impact. But we have also 250,000 women who have not been able to really have access to family planning. This situation is due, as you said, to the disruption of this health system. Our health system has been completely disturbed by COVID-19. And what we have seen is something important in overload of the structures, but also a complete financial deficit of these structures. And this system has been, because of the crisis, focusing on more emergencies. And some programs, like the programs for women, has been neglected. And this is an issue we need to be clear and to put clear on the table. This is why we can say that we have a very important impact in health and the health of the women and the girls particularly, but it is also a socio-economic impact. Why? The women are often, because they are working in an informal system, they are the ones who have been really shocked the first, because this system is not strong and often they have lost their job. And when they have lost their jobs, they go back home where they can see that their children are there because the schools also has been shut. The women have done hard work at country level, but the girls also often, because they are not in school, are going back to home to support their family. And what we see is that often they are not going back to school. Mm-hmm. And this is another issue we have in Africa, and I am maybe in other continents, but it is what we have seen. Mm-hmm. But domestic violence also has increased. A study in South Africa has also documented very well. But I was discussing just now, and I realized also that this domestic violence is everywhere in the world. And this is some important point to explain what happened really in our countries. And it will be important to ensure that every measure we will take, we will have a gender approach, because this is showing that women and girls are particularly affected. And if we want to reconstruct our country to be more resilient and our health system to be more resilient, it will be important not to forget the women and the girl and put them at the center also of the solution. And this is really what I wanted to say in the short.
Thank you.
4 minutes. Thank you.
Thank you very much, Minister. Short, but very impactful. Thank you very much. Let me pick up on the point that you made about the socioeconomic impact. And I'll just go to Rosemary Maburu, if I may. One of your organization, WACCI's missions is to promote equity in health, but from the sound of it, the disruptions caused by the pandemic, in fact, are causing the opposite. So perhaps you can say a little bit about what you are observing amongst vulnerable communities in your country.
Yeah, thank you very much for that. I think for me, I think it's the first thing is to bring the perspective that COVID-19 came at a time when the whole world was off track in terms of meeting most of the global goals, whether it's on gender equity, whether it's on HIV, TB, malaria, and so on and so forth. But also when the pandemic came, it found deep and long-standing inequalities that disadvantage women and girls. And the way the pandemic has pushed millions of people into poverty, we know that in situations of extreme poverty, women and girls suffer the biggest risk and the biggest burden. So you have that context and scenario. And when you then couple that with large disruptions and reduction in access to essential health services, you have a ground that is really fertile for the long-term implications and impact on the livelihoods, on health outcomes. I'll highlight, there are many, many ways in which communities have been affected. I'll highlight very quickly only 4. When you think about maternal health, on the ground, one of the concrete and practical things that we saw is a challenge that women continued to die because of causes preventable due to pregnancy and childbirth. With the introduction of lockdown during the pandemic response, we had women struggling with transport to facilities. We had women struggling with even commodities and services, even while they were already within the facility. You mentioned about the issue of oxygen. We had disruption of services and diversion of services, for example, from maternal wards to the COVID-19 response spaces, and that really affected women in terms of handling pregnancy and childbirth. The other example is on sexual, reproductive, and health and rights, especially for adolescents, if I may focus on that. Communities worry, and we continue to worry about the girls who are now part of the increase in teenage pregnancies. We saw a lot of that during the pandemic, and we continue to see that. We are worried about the girls who married early, either through forced marriages or either voluntary because of the context that we found ourselves in. And what that does, it also creates space for the likelihood of increased infections in HIV and other issues. but also we recognize that what the lockdown did and the pandemic response did at that time especially is that in many countries, we lost a whole year of school. And being out of school and in situations where safety nets were disrupted, places where young people and adolescents could actually go for youth-friendly services was not available. And that really led to that particular challenge. The other issue I would like to point to is the disruption around routine immunization. Mothers were worried that the way, for example, tuberculosis and malaria presents, was quite similar in some ways to how COVID-19 was presenting. And mothers kept their babies at home, not just because of that confusion of symptoms, but also because of the worry of the infection when you go to the facility. But also because there wasn't continued attention and access to that service, even when mothers actually did get to facilities. And what that did, it also undermined the effort on the response to TB and malaria and HIV. So really looking at safeguarding those efforts and mitigating that challenge is really something that we have also seen and has been a challenge. And so you have all these children who have missed their routine immunization, all these under 5 children, and that has long-term implications. And the last thing is on nutrition, basically with how it affected livelihoods, how it affected mothers' ability and women's ability to support families. That means undernutrition, and it has long impact on stunting and the human capital development in many countries.
Thank you very much for that view, Rosemary Maburu. I'd like to go now to Marie Pangestu, if I may, and Managing Director. Those figures that I quoted a moment ago at the outset of the discussion were in fact publicized by the Global Financing Facility, which was one of the very first to warn about the disruptions of essential services that could be brought on by the pandemic. In fact, that warning was issued by the GFF just days after the WHO recognized the pandemic as such. Can you say just a little bit about why the consequences, in your view, have been so especially devastating for women and girls?
Yes, thanks. And I also listened very carefully to the other previous speakers with real examples of the consequences for women and girls. I think what we've seen, the pandemic has led to a rise in extreme poverty, and the poorest and most fragile countries have been experiencing falling public revenues, rising debt, and constrained fiscal space. And we see that the pandemic is pushing almost 100 million more people into extreme poverty in 2020. On top of this, the pandemic risks reversing the gains for women and girls. And this is the point about related to the secondary health crisis that we're all talking about. We know that women have borne the brunt of the secondary impacts from the pandemic, including gender-based violence, protracted school closures, and unpaid care, in addition to disruptions in healthcare. And here today, we have numbers that show that for nearly 4.9 million people reported deaths, we are not hearing as much the ripple effect on access to health services. Stretched health systems, lockdowns, fear of contracting COVID-19, as was just illustrated, and financial hardships meant that fewer women, children, and adolescents were getting the essential health services necessary, such as routine immunizations. And I think it was just mentioned, this is really going to seriously affect the children that will not be getting immunization, stunting, and so on, cognitive ability. Pregnancy care also has been reduced, and family planning, most importantly. The budget constraints have really disrupted family planning. Combination of school closures and disruption of health service may also increase teenage pregnancies. School closures hinder access to safe places after school for adolescents, further heightening the risk of global gender-based violence and pregnancy. So, I think these are all kind of the numbers that we are seeing. And you mentioned the number of how life-saving health interventions dropped by 25% for women, children, and adolescents. And that data comes from data we collected across 36 countries with some of the lowest maternal and child health outcomes. And emerging evidence from GFF does show that persistent and large reductions in the utilization of these health services due to COVID-19 are far-reaching and have devastating consequences for women and children. And across some of the poorest countries, the estimated increase in mortality caused by drops in the use of essential health services, as you also mentioned and emphasized by the minister, is more than double the official reported COVID-19 health toll. So let me repeat it again. For every reported COVID death, 2 or more women and children are dying due to the disruptions in the health system. So what is clear is that while we continue supporting the immediate and long-term pandemic response, we need to put women, children, and adolescents at the center of these efforts. Otherwise, continued disruptions will continue to have long-term consequences for individuals, communities, and economies in terms of teenage pregnancies, stunting, rise in HIV, and so on. And these will have irreversible impact. The hard-fought gains that we've achieved in recent decades towards ending maternal and child deaths and future progress is really at stake if we do not act now.
Thank you very much, Marie Pangestu, and we'll come back to you and others shortly to talk about how we act to try to address this crisis. Let me first drill a bit deeper with some of the international development partners who are with us, and I'll go to Parliamentary State Secretary Flaxbart, if I may. As we just heard, the GFF, in fact, warned very early about a potential disruption of essential health services. I wonder how it was for Germany as one of the most important donors in global health, including in relation to the COVID-19 response. Was the disruption to essential services something that you foresaw early on, or did you wind up needing to pivot your support in order to respond to this emergency?
So Melinda, I couldn't agree more to all these things the speakers before mentioned. This is exactly the information we got. The devastating impact of COVID-19 in many areas, as the right-based family planning, as maternal and newborn health, as comprehensive sexuality education. We heard about a severe increase in harmful practices such as female genital mutilation, gender-specific violence, child marriages, but also the missing routine vaccination for children. All these led us to a reaction, and in order to strengthen just this crisis-resilient health systems, we have shifted, we have reprogrammed, we have increased our funding for ongoing bilateral health projects as well as for multilateral health system strengthening. And so we try to ensure continued access to family planning, attended birth, other essential SRHR things with a bigger core contribution to UNFPA, to GFF, to IPFF, and to others, of course, to our bilateral partners. So this was our very, very quick reaction, just to make it a little bit better.
Thank you very much. And we're going to dig a bit deeper on that as well shortly. Let me go now to Julia Spencer and Peter Sands to talk a bit more about interruptions in access to essential health goods and services. And Dr. Spencer, we're hearing a lot these days about supply chain gaps and weaknesses. Is that affecting the availability of basic vaccines, not only, of course, anti-COVID vaccines, but others as well when it comes to poorer countries?
Absolutely. And maybe just to step back a moment to talk about the fact that There are a number of factors that are leading to the challenges that we see with routine immunization. Logistical issues are one of those, and that includes both upstream as well as downstream supply issues. But it is also the additional costs and the resources that are associated with delivering vaccines from the port to the place of vaccination, as well as actually administering vaccination. And part of it is the costs of personal protective equipment and retrofitting facilities or moving into different facilities so that programs can vaccinate people safely, as well as ensuring that some of the issues that my fellow panelists talked about, with people being concerned about being able to show up and get vaccinations safely, and that they're not going to be exposed to COVID or to other infectious diseases, because the health system is so saturated with people that they're treating for COVID and other related diseases. But if we zoom in on the supply chain, which is an issue that I actually had the opportunity to talk about at a recent United Nations General Assembly side event with the Corporate Council in Africa, what I heard from many of the people in the audience was that these downstream supply chain issues are the biggest concern for programs in Africa. And I think there are a lot of things that are starting to happen to see how we can creatively address this, not just within the pharmaceutical sector and the value chain, but with all kinds of public and private partners that are coming together to figure out how to get vaccines to the people that need them. But just to talk a little bit about the upstream issues, which means what do you need in the supply chain to actually be able to produce a vaccine and then get it shipped? And from that perspective, we have had a number of challenges with lead times for input supplies, whether that's tubing or bioreactor bags or the actual materials that go into a vaccine, the ingredients of a vaccine, because there has been a required more than tripling in some cases of the supplies that are needed to make COVID-19 vaccines. So every vaccine manufacturer in the world that makes routine vaccines has been struggling and had to deal with these lead time issues. And I'm very, very happy, and I think we feel very fortunate to say that we have been able to stay on top of those at MSD, and we have been able to continue to supply all of our vaccines to the people that need them all over the world. But there is additional ramp up of COVID-19 vaccine manufacturing. And I think all of us are trying to do everything that we can to ease trade issues, to get supplies moved forward across borders as quickly as possible, so that these very real challenges of lead times can at least be mitigated and they're not exacerbating the problems of routine immunization. But the bigger challenges are on the ground, where it is shipped from our facilities into ports and then have to get to the places that need them. And before the pandemic, the supply chain, especially things like cold chain equipment, were a very, very big issue in a lot of countries around the world. And now what they're having to do is supplement those cold chain systems to do COVID-19 vaccination. And they're very much struggling to do that. We also see that adolescent vaccination in particular is a challenge because of where vaccines are delivered. They're typically delivered in schools, and schools have been closed. And so just like many of the other issues with school closures, immunization has become a victim of the inability to actually access this population. So this all means missed opportunities for vaccination. And even data from the US, which is a study that we recently completed, showed that HPV vaccination for adolescents was reduced by more than 20% during the pandemic. And the modeling that we did suggested that it could take between 2 and 10 years to be able to recover that. So when we think about what immunization programs need to do now, they need to ensure that for the babies born now and the children and the adolescents and the adults that are eligible today and tomorrow for vaccines, that they're able to find them and deliver vaccination services to them. But they also have hundreds of thousands and millions in total of people across the world that have missed out on vaccination, and they need to be able to find them and they need to be able to convince them that they would benefit from that vaccination in order to catch up on all of the losses that we've seen over the course of the last 18 months. And I think vaccine inequity or vaccine equity is particularly important here because it takes more to find those that are underserved and that are difficult to reach from a geographic perspective. But I think we do have opportunities because of COVID vaccination, where we see schools being used for COVID vaccines or schools staying open for routine immunization, even though they've been closed for learning in Latin American countries. There was a recent story about community vaccination and family vaccination in Nigeria, where when adults come to be vaccinated for COVID-19, bringing the family and enabling vaccination for routine services. So, I think what we can do through panels like this is to be able to talk about the fact that routine immunization has to continue, that the resources and the infrastructure need to be in place for immunization systems to also be able to mount an effective response against COVID. But they also have a lot on their shoulders when we talk about improving health security. And they're already being asked to do more in the future than they've done in the past. And so infrastructure, funding, and continued resources for these programs are going to be essential going forward.
And we're going to pick up on that shortly. Thank you very much, Julie or Spencer, for that. Also for the reminder that the supply chain crisis has life-threatening effects and is not simply about whether people in wealthy countries get their Christmas presents on time. Let me now go to Peter Sands to talk a little bit about the interruption in treatment for tuberculosis, malaria, and HIV, something that a couple of speakers have mentioned. Is this also largely a supply chain issue, or what's causing this, and what are the effects that you're seeing?
Thanks, Melinda. And the answer is that the disruption to HIV, TB, and malaria services have a range of causes, from COVID-19 itself, diversion of resources, to the lockdowns, and also supply chain factors. When I focus on the challenges faced by adolescent girls and young women, I have to say the one that immediately strikes me as particularly worrying is the disruption to prevention services for HIV. In fact, the HIV community did a pretty good job in responding to the crisis in maintaining antiretroviral treatment services for HIV positive people. In fact, in 2020, antiretroviral treatment, numbers of people on antiretroviral treatment went up by 9%, but prevention services suffered enormously. We saw an 11% reduction in the numbers of people being reached by prevention services. We saw a 22% reduction in HIV testing, and we saw about a 5% reduction in the numbers of mothers receiving treatment to prevent transmission to their babies. Now, all of that disruption to the prevention side of HIV will tragically result in more infections. And what we're also seeing is lower enrollment rates onto treatments. So we run the risk of more HIV positive people who aren't receiving treatments. And that will ultimately translate into more people dying. Why is this particularly a problem when we think about it in terms of adolescent girls and young women? Well, in many parts of the world, and particularly in Eastern and Southern Africa, the most vulnerable population to HIV infection are adolescent girls and young women. And this combination of closure of schools, gender-based violence, disruption to sexual education and health services, and disruption to specifically HIV prevention and testing services is a combination that will inevitably lead to higher HIV infection rates among adolescent girls and young women. And this is a tragedy, because particularly in the last few years, partners involved, including GFF, Global Fund, PEPFAR, many community organizations, have actually made some fairly significant progress in reducing HIV infection rates among adolescent girls and young women. So to lose that hard-won ground, and because it has such long-term consequences, is a real tragedy, and one we must really work hard to reverse again and get back on track. One other aspect that, just reflecting on the previous panelists' comments, that I might just want to emphasize and draw attention to is the role of women as health workers. In many low and middle income countries, health workers, including community health workers, play an absolutely vital role, both in delivering essential services pre-COVID, but also in delivering the response to COVID-19. And these are disproportionately women. And these women have had a disproportionate risk of being infected by COVID. And because the viral loads when they get infected are often quite high, have a disproportionate risk of more severe cases and a greater risk of mortality. And so women, both as recipients of health services, but also as providers of health services, have been acutely affected. And coming back to the point of health workers, we still see significant gaps in the provision either of being prioritized for vaccination or in the provision of PPE for health workers, particularly informal community-based health workers, despite the risks that they run as they provide care and treatment to others. So both from a specific disease perspective and in their role as playing being a disproportionate part of the health workforce, women, I think, have been particularly exposed to this crisis.
Mm-hmm. Thank you so much, Peter Sands, and thanks to all of you for sharing your perspectives on both the causes and the effects of this emergency. And clearly, it does represent a major setback for the steady, if uneven, progress that many countries had been making in improving health services for women and children. So how do we reclaim those gains, as the GFF has put it? That's what I would like to now talk about with all of you in the second round of our discussion. How do we restore essential services? How do we improve the responsiveness of health systems to vulnerable women and girls and children? That is our topic. And I'd like to just remind the audience, you can send us your questions using the Q&A tab on the live stream, and we'll come to those questions a bit later. Let me begin with you, Minister Kolsek, and I know that you do need to leave us shortly, but just two brief questions, if I may. First of all, what concrete measures you believe can and must be taken in the coming weeks and months to roll back the health system disruption that all of you have so poignantly described? And secondly, the question, a devil's advocate might say, look, at some point the pandemic will end and things will go back to normal. So what would you say to that view about why it is urgent that we act now?
Thank you. We have lost a lot. All the indicators are showing it. And we cannot wait more. It is why we have a sense of urgency. More you are waiting, more the description will be. And it is why I don't want to follow those who are saying that it will finish very soon, because also we never know. We saw with COVID-19, we have one wave, second wave, third wave, some are the fourth wave. We never know. We don't know how it will be. And a strong health system, a resilient health system is important. We cannot wait the end, or we cannot wait another pandemic, we never know, to start to do things. It is why, for me also, the leadership at the highest level is important. And I would like to take the example of Senegal. where the president of Senegal, His Excellency Macky Sall, has put very clear the resilience at the center, and women also, by for supporting the poorest of the population, and particularly the more vulnerable, and there you have the women, giving them support for nutrition, support for cares, but at the end of the day, focusing also on the side effects, employment, etc., particularly on young people and young girls. And a plan is on place for that, but also a plan to reinforce and strengthen the health system. The health system, we need to look at it and not forget any programs, because what happened is that we focus on COVID and we neglected the others. This is something we need to avoid in the future, and put more money, local money, but because not only waiting for people from abroad or countries like Germany who support us to come and do something. We need ourselves to do that. And this is why I say the highest level, understanding the situation is important, because a lot of strong measures need to be taken, but also partnership, and it is why I am happy to be here also today and to support really the GFF in the work they are doing, because they have a process which is a country-led process. What we have seen is that we are doing our own business case, and we are putting everybody around the table, and the global financing facility is coming to match or to complete the gaps. This is what we are expecting, not a top-down approach where people can come and say, I know you have a problem in your country, we are giving you this. No, maybe it is not what is more important. So the way of working is something important. The other point is, today, these also need money. They cannot do things if they are not very strong financially. And it is why Senegal and Canada has agreed to co-chair the replenishment of the GFF. And I would like here also to say that every donation are welcome, because this will go to countries and will go to support countries strengthen their health system at all levels of the pyramid. It's not only in the capitals, but it's everywhere. And this is a process we would like really to support. I think that we need to act now. We cannot wait. We have said that with Ebola in our sub-region, please strengthen the health system, because it was a key issue. But we didn't do that properly, and COVID came and we had the same problem. We cannot continue also to always do the same constat, do the same analysis, and after we forget it. We need to do that now. And I think that with all the partners, all the people, it will be very good. And I think that solidarity is something important, but also we need to look at our own countries and mobilize people internally to be able to receive properly all the support coming from abroad. This is what I wanted just to say to start maybe the discussion. But
thank you.
As you said,
I know you do. And Minister, thank you very much for taking part. I know the busy demands on your schedule, and also for underlining in that response both the urgency we're facing and the need for holistic country-led solutions. So many, many thanks. Let's give Minister Kolsek a warm round of applause, please. And if I may, I would like to go straight over to Parliamentary State Secretary Flaxbart and ask you what you think the international community should do differently. How can it more effectively support countries where women and girls are facing this kind of disruption, this kind of emergency?
First of all, of course, it's a question of money, of more money. So we try not only to give good advance, but also just to help, in fact, to increase our support for many institutions like the GFF, like the FFG, like IPPF, like UNFPA, and UNICEF and others. This is first of all. If I may tell you. We have supported UNFPA in 2020 with 70 million euros on top. We try to continue this. We try to support GFF in 2020 and 2021 with a total amount of 50 million euros. And so on. We have a program, maternal and newborn health fund, with up to 100 million a year. So these are nice numbers, I think. But over that, we call on the international financing instruments to harmonize their multilateral investments for a better working together, for a better coordination, for a better collaboration, because we have to, and I very, very much agree with Madam Minister, we have to strengthen our primary healthcare systems, so that we are prepared to face another pandemic, another epidemic, so that we are prepared. The best is to prevent the next pandemic or the next epidemic, the next disease, so that people in the villages, that they trust in the healthcare workers, that they know them, that the healthcare workers are prepared, that they have enough material just to work, that they are good educated, that they get wages which are sufficient. So in all these systems we have to invest, and the best way is as when everybody in bilateral work as well as in multilateral work together and collaborate in this aim. Thank you.
Thank you very much. And let me go to Marie Pangestu to pick up on that. And Marie, I mentioned the Reclaim the Gains campaign. In fact, the World Bank is co-hosting that with the GFF, and the Parliamentary State Secretary just underlined the need for funds, for money. Clearly, that's part of what you're trying to leverage. But beyond that, I know that data and evidence are also important in this campaign. So perhaps you can talk a little bit about that as well.
Yes, thanks, Melinda. I wanted to just say that the GFF works in close collaboration with the World Bank to support the continuity of essential health services as part of our COVID-19 response. And the work we do, I just wanted to re-emphasize what Minister Awa said, that the work we do is country-led, so you also emphasized the importance of a comprehensive country-led program. So as Minister Awa said, it's not top-down. We start, the countries start with their own analysis and understanding the gaps of what's needed. And we work with countries and partnerships with other actors, other key actors, to support countries design their own plans and necessary interventions, obviously with evidence-based and analytics and diagnostics. And once these frameworks and pilots are done at the country level, then financing, whether from donors or also our own financing, such as IDA, which is our lending to the poorest countries, or actually it's not just lending, it's grants and concessional lending to the poorest country, then can come in at scale can come in to scale up the interventions. Therefore, it's very important to have this basis of country-led. And the work that the GFF and the World Bank have been doing focuses on three main areas. First, integrated community and primary healthcare systems to ensure that countries have the necessary deployment capacity to roll out tools while protection of essential health services and training health workers and building trust in immunization and strengthening data and tracking systems. So, and as well as engaging the community to address COVID-19 fears and vaccine hesitancy, which is, I think, one of the core issues we have found in looking at the vaccine, at the readiness of countries to deliver vaccines. And of course, the longer term issue of promoting the use of essential health services. The GFF is making available specific financing in countries to support immediate needs for COVID-19 tools and delivery while maintaining essential health services with sustained efforts to adapt and strengthen health systems. And throughout the pandemic, GFF has a dialogue with countries to confirm increased need and demand from countries for service delivery and health systems to support with 31 ministers of finance requesting support. So once again, this country-led approach is very important to really have effective interventions which are implemented at the country level. Second area we are working on is the equity response and recovery. So with increased inequalities amplified by this crisis, the most vulnerable and marginalized must have access to the services they need. For example, in Rwanda, we are working with the government to address COVID-19's impact on families working in the informal sector. This support is helping families that are too rich to be enrolled in the public social safety nets, but are still struggling to cover their essential needs to access emergency cash transfers. Finally, the third area is health financing. The latest projections from the World Bank suggest that the majority of low and lower middle income countries will be unable to raise the public funds necessary to finance the country's share of COVID-19 vaccine rollout or solid pandemic preparedness. We were able to support countries to identify the impact of redirecting health system resources to the pandemic response, and are now working with ministers by making the best out of the resources, help align and catalyze resources and efforts across all stakeholders operating at the country level. So lastly, COVID has also told us that none of us can do it alone, and that innovative partnerships and collaboration is more important than ever. So there needs to be the solidarity and partnerships, as the Minister Awa also emphasized. We will not be able to bend the curve without country and community leadership, as well as joint up support with partners like Germany or critical multilaterals like the Global Fund and also through collaborations like ACT-A or the Global Action Plan.
Thank you very much, Marie Pangestu. And I see we do have some audience questions coming in. So let me bring in just one brief one that's directly related to what you just spoke of. This comes in from Trimor Chawarura, and says, indeed, there were and are still many teenage pregnancies due to school closures, and this might actually become a trend in our communities. My question is, do we have the funding for data collection and to conduct studies to determine the extent of the problem so as to drive and inform interventions? Could you just say a little bit more perhaps about data and data-based policymaking in this area?
Yes, thank you. Yeah, for sure. We do a lot of work to collect data and evidence-based policy making, and we have been doing this. We have been doing resource mapping and expenditure tracking in helping countries to design the right policies. So if, say, the issue is the teenage pregnancies, we found that school closures and the lack of safe places for girls to meet after school, economic issues faced by them and by their parents are also leading to either early child marriage or teenage pregnancy. So you identify what is the cause, and then you try to address in the intervention you design. You try to address the issues. For instance, creating safe places. If schools are closed, then there has to be a creation of other safe places. I think one of the panelists also mentioned transportation as also an issue. So I think these are really very important that we, and it'll vary between countries, obviously. And this is why we work with countries. I think what Minister Awa was saying, we at the country level, we need to own the problem. We need to, and we help to collect the data and the evidence to understand better what is the exact cause of the particular issue, whether it's teenage pregnancies or adolescents not getting, or children not getting immunization. Like if it's hesitancy, then how do we address that? Communities need to be involved in helping the communication strategy, for instance. And there's a lot of cultural element, as we know, and therefore I think the role of communities and religious and local leaders are very important in the effort to address these issues.
And let's pick up on the role of communities. I'll go to Rosemary Maburu. And Rosemary, here is also an audience question that relates, in fact, to a question I wanted to pose as well. The audience member, Musa Mohammed, says, what are the deliberate efforts that can be used to support civil society to ensure continuity of essential health services? And I also wanted to ask you to talk a little bit about the role of both civil society and community-based organizations here. So perhaps a response that addresses both. Thank you.
Thank you very much. So we haven't seen this kind of community and civil society mobilization, I would say, since the HIV epidemic, early in the days when communities and civil society mobilized for that response. And what we are seeing now with COVID-19 is really communities and civil society stepping up. And even when the pandemic happened, before partners came in, communities were at the center of the response. Communities were at the center of making sure that all the implications we are seeing were mitigated. We've been part of shaping the narrative and the conversation that the response and even protecting the gains is really about people. It's about improving health outcomes for people. It's about really saving lives. And so with that perspective, we've been looking at how can we have better, more resilient and equitable health systems towards that outcome. And so our work has included key messaging directed to policymakers, directed to funders. For instance, we have been talking really about supporting community-led responses to essential health services. Community-led responses have really shown the power of communities, and we know that no global health response will be successful without communities. There has been that evidence. We've also been talking about training and protecting health workers. Partners came in, including the GFF and the Global Fund, to support community-led services, training health workers and protecting health workers. And that is work that actually needs to be sustained and to be scaled up because it has been very useful. The other thing we've been involved in is around calling for domestic leadership, domestic ownership. When it comes to the kind of change we are looking at, the improvement of outcomes, the real change will actually have to happen at the country level. And countries are being supported, but we're also looking for domestic leadership, whether it's in additional resources from domestic sources, whether it's better utilization of the resources that actually exist, is a key message that is coming from civil society. As communities and civil society, one of our role is around advocacy and accountability. Not just so we can get additional resources, but also that the resources that exist are accountable in terms of resources and in terms of results. But we've also been very much, calling for and talking about global solidarity and global health equity. And we believe that it's going to take many partners. It's going to take a united global community to actually ensure that we protect the gains on essential health services, the gains on HIV, TB, and malaria, and many other, as we have discussed, in terms of impact. And this global solidarity can be expressed in many ways. One of the ways is to ensure that the COVID-19 recovery mechanisms continue to be supported, continue to be financed. For example, we do know that the GFF has been partnering with countries around supporting community-led services, around training and protecting healthcare workers. And this needs to be sustained. There is an opportunity right now with the GFF resource mobilization efforts. We need to raise at least $1.2 billion by December this year that can be invested in supporting community-led systems, that can be invested in training and protecting healthcare workers, and so on and so forth, in terms of even mitigating the kind of impact that we spoke about. But we also have many other opportunities to ensure that this global solidarity is manifested by the way high-income countries, the G20 and the like, continue to support these efforts. So as civil society, we are organized in different networks, and really the biggest thing we bring is our voice, is the accountability, but it's also the fact that on the ground, we support the response. And this is what we call upon different partners and stakeholders to ensure that this is supported and is continued for better impact.
Thank you very much. And just to the audience, I have a couple of other excellent questions I'll bring in shortly. I just want to try to pick up right now on the point that has been made here by all of our speakers about the need for an international collaborative joined up approach. And I'd like to now go to Peter Sands and Julia Spencer to talk a little bit about what that looks like for them in practice, and also about both the opportunities, but also the prerequisites for fruitful collaboration. So if I may, I'll start with Peter Sands. And Peter, who are your key partners in working both to ensure restoration of essential services and treatments, but also to try to build resilience of health systems going forward?
Well, I think our starting point in terms of who our key partners are the people on the ground, the communities affected by the diseases, and the governments who are trying to build health systems and coordinate the response to COVID and to other threats such as HIV, TB, and malaria. Beyond that, of course, we have very close partnerships with the World Bank, GFF, with WHO, with other organizations like UNITAID, UNICEF, and so on. And one thing I do think that has been an innovation and a success, actually, in the COVID response has been the intensification of collaboration through the ACT Accelerator, the Access to COVID Tools Accelerator. Yes, we haven't succeeded in getting as much access to tools as we would like, but in terms of the quality of collaboration between multilateral and bilateral partners, I think we have broken new ground there. And certainly from our experience, we've deployed over $4 billion now on top of what we normally invest on HIV, TB, and malaria, another $4 billion to help countries respond to COVID-19, and not just respond directly, but to mitigate the knock-on impacts on HIV, TB, and malaria, the kind of knock-on impacts that have such devastating effect on adolescent girls and young women in the way that we have been discussing. And the way that has worked through C19RM, our COVID-19 response mechanism, has been very much driven by countries through rigorous, transparent, and very inclusive process, including not just partners, technical partners like the World Bank and GFF, but also community and civil society organizations on the ground to determine how the money should be invested, what the greatest needs are. I hope that one thing we do take from this crisis is habit, the pattern of working together as closely as we have had to over the last 20 months or so, because I do think that that is critical to our success. But I would also like to just build on Rosemary's points about the importance of civil society and communities. One thing the Global Fund has learned through 20 years of fighting HIV, TB, and malaria is that you will not succeed in defeating truly formidable infectious disease unless you deeply engage the communities that are most affected with civil society to lead and drive critical elements of the response. That's how you ensure you don't leave people behind. That's how you ensure you really understand what is really needed. And I still think we have a ways to go globally in making the COVID response as open to community and civil society leadership and informed by their insights. In many countries, the COVID-19 response has been quite top down, quite done to people rather than with and by people. And I think that is something that in the next phase of this crisis, as we try and recover from it and mitigate the longer term impacts, that we have a greater degree of community and civil society involvement.
Thank you very much. And Peter, if I may, I have an audience question. I'm going to try to shorten it just a bit, but it comes from Vishal Tripathi, who is from India and is a master's student at the Hertie School here in Berlin. And he picks up on the point that you made about women as health care workers and as vulnerable healthcare workers, and mentions the accredited social health workers in India, ASHAs, who are still not considered regular government workers and are therefore paid honorariums that are far below the minimum wage. And he says, nonetheless, they were at the forefront of the fight against COVID-19 by ensuring door-to-door contact tracing and vaccinations. So he goes on to say, what can we do to ensure that they are treated in accordance with the ILO conventions? More global focus on this often overlooked aspect could be an important enabler in advancing the role of women. Do you have a quick response on that?
The quick response is Vishal's absolutely right. I mean, too many community health workers are either underpaid or not paid at all. And they're certainly not well enough protected from the infectious disease threats they themselves face. And that's not unique to India. We see that in many other countries around the world. So I think what we need to do is collectively elevate the focus on the role and value of community health workers, formalize their role, pay them, train them, protect them, and celebrate their achievements. I think that is one of the most powerful levers we can pull in terms of improving the performance of health systems and therefore health outcomes.
Thank you very much for that. And let me go now to Julia Spencer, patiently waiting there. Julia, I'd also like to ask you to talk a bit about partnerships from MSD's point of view. Who are your key partners in this effort to both to restore essential services, but also, of course, to build more resilient, responsive health systems? And what are your prerequisites for effective cooperation?
Certainly, it's a great question. And I'll start by reiterating the great points that were raised by, I think, every other member of the panel about the importance of trust, the importance of partnering in advance and integrated planning so that you're solving the problems that need to be solved. And there are really three things that we are doing as MSD to play a role in strengthening health services and in particular immunization, but not exclusive of immunization within our company. Number one, as a developer and manufacturer of essential medicines and vaccines, we are ensuring that we are working with our government customers on complex issues like forecasting and delivery and really troubleshooting every day so that our supply of critical medicines and vaccines continues. that takes a priori trust and being able to discuss these issues and troubleshoot them together. Secondly, we are providing our data and our analytics expertise to our partners so that we are collectively understanding what the challenges are on the ground and in countries when it comes to these services. And then third, we are partnering to be able to act directly. And I can't say enough about the importance of having established partnerships and networks in advance, because going back to the supply chain issues, we've been working for years with the International Federation of Pharmaceutical Wholesalers and their federation through a Gavi partnership to strengthen supply chains in Gavi countries for vaccination. So we've been able to leverage that. And that program, for example, we provide needed funding for, but we also match our supply chain experts at MSD with supply chain managers in immunization systems to work together to try to improve the management and really revolutionize supply chains over time. One of the new things that we've actually done in partnership on a longstanding issue of concern to us is this issue of vaccine hesitancy. And this existed well before this pandemic. And unfortunately, we expect it to persist long after. But looking to the table of partners and what each of us brings to the table, we've brought together a multi-sector partnership to launch the Alliance for Advancing Health Online, which is looking at and conducting research on, through research partnerships, what are those behavioral science principles? What are the social media behavioral patterns that we're seeing? And how do people get information in a social environment that enables them to make good decisions about their health, including on immunization? And that really took us coming together to say, what does an MSD bring to the table? What does a WHO bring to the table? What does the Vaccine Confidence Project bring to the table? Even what does Facebook bring to the table? And being able to construct a partnership that helps us all advance the health objectives that we're looking for. And in terms of routine immunization, we really are doing a variety of things, from community education to just raising the alarm in settings like this and in every meeting that we're in, to talk about the fact that a problem exists. Because as Melinda and I were talking before the session, all of us in this room and on this panel understand that this is a challenge, but not everybody out there that needs to know understands it. So giving our voice to this issue is something that we do spend a great deal of time on. And then looking beyond immunization to maternal and child health. Actually, Rosemary and I were having a conversation before the session, because she said, well, do you work with MSD for Mothers? And I said, yeah, that's our program. And that is a 10-year-long program that we've been working with governments around the world. And we've been able to leverage that to try to support essential services for expectant mothers and new mothers around the world, including in Kenya, where I was able to share that we're addressing one of the issues that Rosemary raised to me, which is how do you get transportation services to women so that they can access the prenatal and postnatal care that they need, that may be life-saving to them, and overall reduce maternal mortality. And so when we think about how we leverage the challenges of today to we all say build back better. How do we think about some of the creative ways that we're partnering together across sectors, and let that not get forgotten once COVID is over, but use that to build our systems in a stronger, more resilient, more multi-sectoral way, so that they can do their jobs on a day-to-day basis better, but also be able to support health security in a better way going forward.
Thank you. Very interesting indeed. I have a comment from an audience member who hopefully is still in the room. She's Antonella Santuccione. Are you still here, Antonella? Then she would like to pose a question about women's participation in clinical trials for vaccine development. And I'll just ask you, Antonella, because of our time, we're very, very limited, if you'd go straight to the question and leave away the comment. Thank you.
Just my affiliation, Women's Brain Project. This is my nonprofit, which we co-founded. My official employer is Biogen. The question. So what we find out is that even in the vaccine that were developed for COVID and their efficacy and safety, a disproportion of side effects were found in the female population. This is a matter of concern. It is reflected in any type of vaccine that it is currently developed worldwide. And what we advocate, it is stratification of clinical trials development by sex and gender, such as efficacy and safety profile can be characterized accordingly. So I would like to have a comment from the participant in the panel, if possible, and understand how we can shape and ameliorate this unmet need that it is absolutely fundamental for women's health.
Thank you. And let's ask Julia to speak to that, if you would, please.
Certainly, and I am not a physician by training. I am a public health doctor. So I will not talk specifically about the safety profile of the COVID-19 vaccines. But what I can say is that there has been a lot of discussion and a lot of work that has gone on, certainly within our own company, on how we work with potential clinical trial participants and people who eventually do become part of our clinical studies, because without them, we don't make medicines and vaccines that other people around the world can benefit from. And I think we obviously have started a journey in thinking about how you best support clinical trial participants based on their characteristics. But I think we have a long way to go. I did work on these issues in the US government before I came to industry. And I'll just say that, at my company and certainly in others that I've talked to, is there is a very laser focus right now on trying to understand what some of these challenges are. These programs were done very rapidly. I won't say they were done hastily or they were done quickly. And I think the characterization of the safety profiles has really come forward very rapidly. But recognizing that this is not the way that we typically do clinical studies. They usually are done over a longer period of time where you have more information on the durability of protection because you've been studying them, for 3 to 5 years before they are out the door. That does not mean that the safety is not robust. But when you develop products quickly, there are certain things that you know less about and that you have to learn about over time. And I know everyone in the industry is continuing to work with post-market safety studies so that we are ensuring that the entire safety profile, as well as the efficacy and the durability profile, is very well characterized going forward. And I'd be happy to talk with you later about connecting you with the real experts in my company who can share more information.
Thank you. Thank you very much to Antonella Santuccioni and also to Julia for that. Let me take one more audience question that has come in virtually. And I would like to pose this, if I may, to Marie Pangestu and then also have Parliamentary State Secretary Flaxbart weigh in on it. The question is this: one of the lessons learned already during the Ebola crisis was to strengthen health systems overall to ensure the continuity of essential services as a proper response, as well as a proper response going forward. This will require long-term funding from partners directed to the health systems in general and not simply to particular programs. However, this is still far insufficient. Essentially, it's going back to that holistic country-driven response issue. Marie, can you say a little bit more perhaps in response to this?
Yes, thanks for that question. Obviously, that's one of the big top of mind discussions that's going on. As you know, G20 is having these discussions, but I think let me just respond very quickly to 2 points. One is I think you have to start with that holistic country-led approach, where as you are responding to the pandemic issues, including making sure that secondary health services to women and children are not being put aside as you do the pandemic response, you are also focusing at the same time on strengthening the health system, strengthening the health workers, strengthening across the board. And that is the learning we've had so far. And again, so this requires us to make sure that countries do this short-term and long-term view at the same time. And we work with countries to do that. Second is the financing aspect. So this is where the planning that we need to do to understand the diagnostics and the evidence-based policy making is very important to identify in that country what are the gaps. What are the gaps in what to do in terms of strengthening the health system, and where will the financing come from? Some of that will have to come from the government's own financial resources, and then what's the gap? So this is exactly what we are doing now in the context of what's being discussed in the G20. What is the gap? What is the instrument gap? What is the financing gap? And where should that financing come from? Obviously, the World Bank with its financing to the poorest countries, IDA, which we are also now looking for replenishment. And then we have IBRD. And then there's a lot of asks right now for increased financing on this. But it's not just the funds, I think that's important, but how you use the funds effectively is really what we should all be focusing on.
Thank you very much. And the question, by the way, came from Sarah Bruce. Let me just go to State Secretary Flaxbart briefly on the same point, if I may. And of course, resilient health systems, universal health coverage, essential parts of the Sustainable Development Goals. And yet we're certainly not where we need to be on these. How do you see it?
Yes, it is. And it's in the core of German health politics for long years. So in this question of strengthening health systems and in the field, of course, of primary health care, the three big Gs, so the Global Fund, the Gavi, and GFF should increase their cooperation within taking other UN institutions, coordinate their actions in line with the Global Action Plan for Health, Life, and Well-being for All. We, Germany, we are continuing to be committed to implementing the Global Action Plan, which is intended to contribute to this sustainable health financing. We know that we will either master the secondary health crisis together or not at all. And I find this is so important. So let me underline once more that as donors, we have to assume responsibility and further improve of our mutual coordination. And so let us use our time to create further synergies so that especially women and adolescent girls have access to what should come first in all crises, the right to protection. And this includes, of course, the right to a basic health service.
Thank you very much for that. And I'm afraid we'll have to wrap up the audience questions there. But dear ladies and gentlemen, thank you so much for your input and your attention. And of course, many, many thanks to all of our speakers as well. Stay with us because I would like to ask to wrap up this very, very interesting and insightful session. Closing words from Juan Pablo Uribe. He is Global Director for Health, Nutrition, and Population at the World Bank, and since the beginning of this month, Director of the GFF. So welcome to you, sir, and perhaps you can just say a little bit about what struck you during our debate. What are the main messages that you'll be taking away with you?
Thanks so much, Melinda. And by the way, congratulations for an excellent moderation. Very well deserved, I would say. I would also want to thank the German Ministry for Economic Cooperation and Development and GFF for hosting us here today. And a very special thanks to all the panelists. Peter and Mary, we felt you very close to us here, so thanks in the distance. And I think we had panelists that show us how leadership takes action. And so congratulations to all of you. Three core messages that I'm taking from this incredible 1.5 hours. First one, of course, is a shocking reality that creates this huge need for action. It's this secondary health crisis, which is eroding human capital, well-being, and causing incredible pain. It's a burden of disease that is far beyond COVID and overlaps with COVID. And we need to keep it in mind and also in our agenda, in our efforts. It has this long-lasting impact that our panelists have talked about, and it's particularly hard in women, in young girls, in adolescents, in children, in the most vulnerable communities. So I would say that's the main first message. We know about it, but we need to be conscious about it every day in our work. I would say the second biggest message has to be that there's a way forward in our actions if we listen, feel, and act properly. First, we need to focus a lot of attention in the essential services, those that matter the most for the vulnerable. And we know this. We know the importance of maternal and infant services, the importance of nutrition, of sexual and reproductive health rights and services, of vaccination beyond COVID vaccination. We know the importance of quality of care, of humanism in care. We know the importance of the community health workers and the primary health care. These are all elements that have been brought here, and we need to, again, be sure that we do action to sustain those services. And we also know that those efforts have to be comprehensive and within a sustainable structural capacity, which is brought by health systems. Also there, we know that we have instruments like the Global Fund and like GFF, just to mention two who have been here with us, which are instruments that have all the features that we need for effectiveness on the ground. And I'm talking about instruments that are country-led and country-specific, that have strong and visible civil society participation, that have multi-stakeholder support, that focus on results, again, in those services that matter the most, and that have a catalytic capacity to mobilize and scale up more resources and therefore a greater impact. Finally, I would say, Melinda, that we have also understood that we need to, in a way, stop this paradox in many of our countries, where for trying to vaccinate, we have stopped vaccinating. For trying to serve, we have stopped serving. For trying genuinely to care, we have stopped caring. We need to be ambidextrous. We need to be ambidextrous. We need to be, again, conscious that we have to respond to the COVID challenge and overpass this pandemic, but that in doing that, we cannot sacrifice the gains that have been so hard to achieve and that are so important for our communities. And in particular, again, for women, for children, and for adolescents. Thanks so much.
Thank you very much. Juan Pablo, very, very inspirational last words there. Thank you. And again, many thanks to all of our speakers for your participation. I think indeed we have hopefully raised public awareness of this emergency and hopefully also identified some crucial parts of the solution. So many thanks to all of you for your participation. And with that, we close the panel for today.